When Tanya first worked here, I had to work very hard.
Welcome to Senior Moment with Nurse Linda on the STRN Network, the future of Internet, radio, and TV today. This is Dr. Charles Campbell, the man behind the curtain, and this is the brains behind the whole operation,
I have people who might argue that point.
Nurse Linda. We're talking about breast cancer again,
Yes.
Breast Cancer Month.
Absolutely.
This is the closest I could come to pink other than my complexion.
And I wear pink some days of the month, but I don't wear it every day because pink and my complexion tends to wash me out. So but I'll be at a health fair tomorrow. I'll be wearing pink tomorrow.
Oh, goody.
We're going to talk about that in the third segment. Yeah.
Right. First segment. Ta-da.
Our ongoing issues with breast cancer and what people can do about it, what they have to look for. And our first segment now is going to be, what are the symptoms? What should women look for? Last week we talked about statistics and risk and those kinds of things. Now, what are the symptoms? Like the rest of our bodies, age takes its toll. And as our cells continue to divide, they don't always divide properly. So we've got to keep an eye on things. And this is where, as we age, cancers can develop. And something with breast cancer, you're talking about an organ with very fatty tissue. It's very hard to find something. It's not like finding something on your arm which doesn't have much meat on it. You're talking about something that can be buried deep somewhere. Sort of like Princess and the Pea is how it was described to me.
Uh-huh.
So the princess could feel that pea at that top mattress, but how deeply was it buried? And this is the problem you run into with breast cancer. In the beginning, there are no symptoms of breast cancer whatsoever. These cells divide slowly. They're not dividing rapidly. But once two cancer cells develop, when they divide, they divide into 4. When those divide, they divide into 8. When those divide, they divide into 16, and keep going exponentially from there. So yes, there are times when a lump seems to appear overnight. That's not really the case. It's been there and it's been growing slowly. It's just all of a sudden, when it did that one big boom, you were able to feel and experience what that sensation was like. But the symptoms initially are none whatsoever. Lumps early on, if they're too early, cannot be picked up by mammograms. That's why one mammogram is not sufficient. In order to diagnose breast cancer, you have to have them ongoing because changes are ongoing. If we could stop time, that would be wonderful, but we don't live in a time bubble. What you're going to be looking for are some very, very simple things. A new lump, either in your breast tissue or under your arm. That's a very important place to check, and many women miss that when they're doing self-breast exams. A thickening or swelling of the breast tissue. It doesn't have to be a lump. It was best described to me when you're feeling for your breast tissue. Breasts will normally have the consistency of tapioca pudding. And that's what they feel like, if you can imagine putting a film over tapioca pudding. Now
That's
you're
my
looking,
favorite pudding, by the way.
there you go. Now you're looking for a pea in the tapioca pudding or a small seed in the tapioca pudding. And that's hard to kind of ferret out. That's what you're looking for. So now imagine maybe taking a lump of soft cheese or taking a soft cheese, like a cream cheese, and putting that in the middle of the tapioca and feeling for that. It's not a clear lump, but it's a difference. That's important to think about. A dimpling of the breast tissue, the skin on the breast, okay? If there's something under there, it tends to pull it in sometimes, so you're going to look for that. Irritation could be redness, could be inflammation, could be a warm feeling area. If this lump is near a blood vessel, it's bringing blood to the surface area, that may be a sign that there's something going on. Redness or flaking of the skin, especially in the nipple area, could also indicate that there's something going on, again, because of the location of the cancer. And there are different types of cancers of the breast, and those are what we're going to talk about next week. A nipple discharge. Now, we're not talking about women who are breastfeeding, but when you're not breastfeeding, part of your self-breast exam should include checking for a discharge. That discharge could be clear, it could be cloudy, it could be bloody. And I have a young member of my family who at 26 years old had discharge from her nipple. And with my encouragement, she went and got it followed up and required a fairly extensive surgery, but it was a benign lump, but you still have to get it checked out. Those are the bad symptoms. A change in the size or shape of the breast. Now, it's very true. No two breasts are alike.
Nope.
They're different. Okay? And some women have abnormally, majorly different size breasts. We're talking a change, something that's different for you. And this is where you have to look at yourself. Stand in front of the mirror and look and make comparisons. Very important. Pain in any area of the breast. Doesn't matter where it is. And don't rely on pain to be your only symptom, because most lumps are not painful. And that's a very important. Most people say, well, I have a lump, but it doesn't hurt, so I'm not going to worry about it. No, you have to get this checked out. This particular young lady wasn't having any pain, but these are the symptoms she was having. So you have to get that checked out. The other thing to remember, and especially hard for women to ferret out what's important and what's not, is fatigue. Sometimes that's a very early symptom. But if you think about what your body's going through, it's going through all these cellular changes, it gets tired easily. And you'll be more tired than usual. So stop and think and check, and you can't do it often enough. The recommended time for doing a breast exam is once a month. And we're going to do a demonstration of a breast exam next week when we do our show. But those initial symptoms are very, very important to discuss with your doctor, address, and do not ignore.
And when you're doing a breast exam, under your arms too.
Absolutely. You have to include under the arm. And we're going to, in the next segment, we're going to talk about screening and diagnostic, and we're going to talk about why that's important to feel under your arm as well.
If you see any of these symptoms, see your doctor immediately.
Absolutely. And you can see either your primary doctor or your gynecologist. Either one will address this for you appropriately.
Yeah, but don't wait.
No, no,
Do not get in denial.
no, absolutely
Look at
not.
those pyramids going down the river. No. It could kill you. Could kill you. So our second segment is going to be
About screening and diagnostic workup. If you find a lump, what to do next and what your doctor may order.
if you have a question on this, call Nurse Linda at 803-941-7231. That number again, 803-941-7231. She'll be glad to talk to you. Or send her an email at brookehc@sc.rr.com. Stay tuned for our next segment coming up right after this.